Hello, good morning, afternoon, night, depending on where you're based. Today I'm going to present our publication, Changes in Use and Utilization Patterns of Drugs with Reported Shortages between 2010 and 2024. A bit of a background, shortage of essential medicines has a harmful impact on patients' health. It increases the rates of mortality, adverse events, and drug errors. And it also increases the economic costs of the treatment. When we started drafting the protocol of this study, it was May 2023. So the COVID-19 pandemic was still very recent in our minds. And what we saw during the COVID-19 pandemic was that drug shortages were exacerbated for multiple reasons. So at that time, we wanted to use the EDEN network to assess the impact of drug shortages on patient care in multiple countries and populations. So the first aim of this study was to describe the incidence and prevalence of medicines with suggested shortages and their alternatives. And the second aim was to characterize these incidence and prevalence users in the terms of like potential indication, treatment duration, or dosage. So what we did was we started by looking at the European Medicines Agency catalog, and we obtained the information of the drugs that were reported as in shortage for more than 1 year in the European Union. And then we obtained the alternatives from the literature. Then we divided the study analytical call in 3 stages. We first ran a feasibility analysis to ensure that the data partners would have enough data to run the study. And then we had different blocks for the incidence, prevalence, and characterization. So we basically sent a call to the EDEN network, and we finally got the results for 52 databases, all of them previously mapped to the OMOP CDM, although some of the data partners, this was the first study they ran in their OMOP data. So we had include 16 drugs with reported shortages, plus 51 alternatives. But for the sake of time, I'm going to just focus on some highlights of this study. So from the incidence and prevalence analysis, what we observed was that varenicline and amoxicillin, either alone or combined with clavulanate. Varenicline is a medication to stop smoking, and amoxicillin is one of the most common antibiotics. So what we saw is that these two drugs were in shortage in the largest number of countries and databases in the study, and we defined this shortage as a drop in use of more than 33%. So if we have a closer look at the varenicline use, here in the plots, you can see the incidence of varenicline in primary care databases, that's on your left, and in secondary care databases in your right. And you can see that after the shortage was announced, which is indicated by these gray panels, the use of varenicline dropped. This plot is equivalent to the figure 3A and B in the manuscript, but there is another panel with other types of databases that I didn't have space to include. And then if we look at the amoxicillin use, you can see here again, primary care databases on the top and secondary care databases on the bottom. You have amoxicillin on your left and combined with clavulanate on your right. And what you can see is that the shortage was more prevalent in primary care databases, so the ones in the top. We also observed that the prevalence of amoxicillin dropped in 2022. This was consistent with the fact that there was different lockdowns and lower interaction with the healthcare system. And we also observed an upsurge, an increase in 2022 that was consistent with an increase in bacterial respiratory infections. And this increase in infections actually led to the shortage declared in January 2023. So these examples have been just focused in the impact of drug shortages in the trends of use, but you can also spot changes in the drug utilization. For example, sarilumab, which is an interleukin antibody to treat rheumatoid arthritis, we could spot that in your left in the panel D, the indication for rheumatoid arthritis decreased when the shortage was announced, and before that the shortage is announced with the is indicated with this red vertical line. So what we saw was that this drop in the indications could be related to the repurpose of the drug for COVID-19. Another way to spot changes in the drug utilization, for example, we could see in one primary care database from the Netherlands that there was a drop in the cumulative use of sarilumab that could be consistent with mitigation measures. So in conclusion, we saw that drug shortages led to observable changes in drug use internationally, either in declines in the incidence and prevalence or modifications in the drug utilization. And this huge analysis was possible thanks to the federated analytics plus OMOP. If you want to learn more about what other results are in the manuscript or in the analysis, you can scan the purple QR. We also have a second manuscript focused on the learnings and how we conduct this study. And I would just like to acknowledge all the people involved in the study. Thank you.